So no shop will be allowed to sell cigarettes during the national lockdown as they are non-essential. He was responding to the Western Cape government's decision to lift the ban on the sale of cigarettes, emphasizing that they may only be sold together with essential goods. Meanwhile, the SA Drug Policy Initiative has said that although the decision was taken in good faith, people who are highly addicted to nicotine and alcohol will develop a range of symptoms such as psychosis, seizures, and even death. SA Drug Policy Initiative, which has called for a reversal of the decision to ban the sale of alcohol and tobacco during the 21-day period. Now, we're joined via Skype by Professor Guy Richards, Emeritus Professor of Critical Care. Thanks so much indeed for joining us, Prof. It's a difficult one, I guess, and depending on which side of addicted, non-addicted one sort of falls, the impact of taking it away suddenly might have. But let's start with just asking about the impact of smoking on the respiratory system, particularly when it comes to respiratory pandemics.
So sure, thanks very much for having me. It is a major issue in terms of chronic lung disease. Cigarette smoking obviously harms or damages the lungs. The commonest harm that we actually see is what we call chronic obstructive pulmonary disease, and this is commonly known by the lay press as emphysema. Now, patients who have emphysema, obviously, if they do develop a viral infection of the lungs, will be worse off because they're starting off with lungs that are more damaged than somebody who's starting off with a normal lung. So there is always a potential then for worse effects if they actually contract the disease. The issue is, though, that the damage in those smokers is already done, and banning cigarette sales during this actual period of time is unlikely to make any difference in terms of the effects on those cigarette smokers.
So there is passive smoking as well, isn't there? That's the challenge of smokers, and they too can then become vulnerable if smokers are allowed to smoke.
Yes, passive smoking certainly is harmful, but again, it's harmful over the long term. It's not that in the short period that one's having a lockdown that you're going to be exposed to cigarette smoke, that you're going to get dramatic increases in the amount of injury to the lung. Whatever injury there is already there. So it's not really of value to ban cigarettes at this point.
So if I have a respiratory issue, smoking or not smoking, during these 21 days, what you're saying is it's not going to increase or decrease my vulnerability. I am in that situation already.
Correct. That's what I'm actually saying. The big issue is that for somebody who actually is addicted to cigarette smoking, forcible cessation of smoking is likely to have two effects. First, that people are going to find access to illegal cigarettes. People have such a powerful addiction that they will find access to them. And if they don't, as soon as cigarettes again become available, they will start smoking once more. So people will only stop smoking if they themselves have made that decision that they're going to stop. If it's forcibly made for them, as soon as those cigarettes become available again, they will restart.
All right, so, you've explained it very well, and I would imagine that, when you set up rules such as the ones we're seeing with this national lockdown, that people like you, scientists, would have been approached. Was that done when this cigarette ban was put in place?
That I don't know. I've got no idea whether anybody was consulted about cigarette smoking specifically. I can only presume that the ban on alcohol was related to decreasing congregations of people who are all drinking together and might be made more irresponsible in the presence of alcohol. I'm not 100% sure at all what the scientific reasons were behind banning alcohol, other than it it was considered to be non-essential, and as a consequence, more deliveries would be taking place and more trucks would be on the road delivering things like cigarettes, and therefore social distancing might be compromised. But I can't see that that's really a good reason.
All right. So medically as well, you don't see any benefits of not drinking during a respiratory type pandemic?
No, it's not that. I do see with alcohol, because there's no doubt that people who are drinking are, as I say, more likely to congregate. And if they do congregate, they may behave in a more irresponsible fashion because they are partaking in alcohol. Cigarette smoking, I can't see that that's going to have any additive effect at this time.
All right. But what about alcohol decreasing the immune system in any way?
Well, there's no good evidence that people or patients who drink are more prone to contracting this disease. The risk categories are particularly people who are older, and particularly over the age of 65 to 70. The presence of diabetes. Obesity appears to be a risk factor, and male sex is another important one. Why precisely male sex is an important one, we're not absolutely certain, but it certainly seems to be one of the risk factors.
All right, coming back to smoking a little bit, other people are taking cannabis and marijuana, and I just wonder if there's a difference between the threats or dangers when you compare cigarettes to cannabis.
Well, it's often said that cannabis smoked, if you're talking about marijuana or dacha, smoking that's not harmful, but it is. It's also very pro-inflammatory in the lungs. The only reason we don't see as much harm generally from marijuana is because people tend not to smoke 20 a day. Whereas when you're smoking dacha, it's normally 1 or maybe 2 a day, and therefore you see less harm in the long term. But they do have long-term potential for inflammatory changes in the lungs as well.
All right, okay. So the heavily addicted, I would imagine, there are concerns. We're hearing about psychosis and extreme withdrawal symptoms that may play out. And I guess that these are so severe that it doesn't warrant trying to get them off compared to the health benefits of taking them off smoking in the short term.
So the major side effects that you're talking about are more frequent with the alcohol addict, the so-called classical delirium tremens, or DTs, that you see when you withdraw from alcohol. The withdrawal effects from cigarette smoking are anxieties and craving, mental clouding, inability to concentrate, inability to sleep. All of those types of things are frequent when you actually stop smoking, and the urge to smoke can be almost overwhelming. And as I mentioned beforehand, if people are forcibly stopped from smoking and they themselves haven't made up their minds that they want to smoke and have committed to stopping smoking, it is unlikely that they're going to be successful.
And also, I would imagine they would have an impact on the people around them that they're stuck in lockdown with.
Well, I guess so, and certainly increased irritability and depression, and along with that irritability, potentially some degrees of violence, I suppose, are always possible. So it would have an impact on those that are around them. Oh. And it may also have an impact on people who already do have psychiatric illnesses, who are forcibly stopped from smoking in terms of trying to access illegal cigarettes or other sources of cigarettes.
All right, so what would your advice to authorities be then, perhaps, as a final word?
So I don't see any good reason to ban cigarette sales unless there is some logistical reason that is beyond my understanding. I don't see that there are any health benefits in terms of it. Similarly, in terms of alcohol, the primary benefit would be in terms of ensuring that if people do drink, they don't congregate in pubs or bars or shebeens or whatever it happens to be and drink together. It is the social togetherness that is actually a problem. The other issue is that people frequently will, in that setting, will often share a cigarette, and that, of course, is dangerous. If people do smoke, sometimes you may share a cigarette, or a dacha zol you may share in a group of people, and if that happens, well, then that's a good way of transmitting the virus as well, or drinking from the same bottle. So I suppose there are reasons from that point of view, but other than that, I think that people are going to find ways around it that are going to create more problems ultimately than the banning of these things.
Okay, Professor Guy Richards, that's where we're going to leave it. Thank you so much indeed for your insights on these weighty issues, and let's hope the authorities have been listening and perhaps reconsider just how far to go with some of these things. Thanks so much indeed. All right,